Greetings, this is Timothy Youngs, also known as a digital apothecary, and today I'm going to be giving a quick rundown on some interesting digital health publications that came out in the week of November 19th through the 25th. So, what do we got this week? To be quite honest, guys, not too much. What we're looking at is not that many significant clinical studies. Rather, what we got is a lot of white papers, and some of them I think are worth highlighting more than others. And what I'm going to do is go quickly through this. So, in terms of publications, I thought that were relatively interesting. There's four of them. One was using video technology to increase treatment completion in patients with latent tuberculosis. It's a 3-month study, and it's an implementation study published in JMIR. It was a study using VDOT, or if you're familiar, you watched last week, I was talking about how Sure here was using the VDOT program in tuberculosis, and this is pretty much the same thing. This one was done in New York City, and this one has been going on for a while. The same group has been rolling out studies for probably the past 3 years. A number of them were published in 2016, looking at using VDOT in comparison to directly observed therapy. And again, VDOT is virtually directly observed therapy, usually done through some kind of web-based camera system to watch a person take their medications. In this case, the VDOT program was not mentioned what they're using, so I don't think it's a proprietary source, but it seems to be something they're doing a homebrew potentially at this case. If you guys know, please comment below. Along with that is also we have what I thought was relatively cool was pharmacy students basically editing Wikipedia articles. This is published in BMC Medical Education. And this I think I might want to do myself at some point because I've seen this at Stanford MEDEX program for education where they were talking about having students basically edit Wikipedia pages, and this gives them a chance to try taking medical information and putting it kind of like a more public feel to it, which is really cool when you think about it, because a lot of people actually go to Wikipedia for medical information, and trying to make it trustworthy information is really tough. So if you're curious about using this for your own students, if you're from an educator standpoint, I would give this a read because it's an implementation. And there is another few websites out there to talk about how to get people in the healthcare field to edit Wikipedia, and there's a full background on it. So that's actually also worth looking into if you really want to go down this rabbit hole. Third is a heart failure app to support self-care amongst community dwelling or adults with heart failure. Now, this is a feasibility study, so nothing groundbreaking at this point. Only looked at 10 patients, and it was more or less assessing how they would use a heart failure app for self-care support. So, I mean, you have that, but take it for what you want. Next, we had the validation of smartphone applications for heart rate measurement. This is relatively cool. And what I got from this was the fact that they looked at 140 patients in a critical care unit, and what they were doing is I think they compared 3 apps against patients who were simultaneously hooked up to an ECG, and they were seeing how accurate they were. And some of it actually showed some pretty good measurements for accuracy and heart rate, but the big catch was, again, whether or not they were in sinus or not sinus, and whether or not there was anything really abnormal, because those apps actually had a hard time picking it up. So those are 4 studies I think that's worth talking about. Now, there's 4 white papers that I think are relatively interesting. First off is more of a medical news thing from Stanford Medicine. It's called The Digital Edge. It's published in the fall of 2018. This is a collection of articles and things that are going on in Stanford, and you might find some of them interested. It's focused more on academics or those that are educational minded. Next is Top Mind for Top Health Systems, published in 2019. This is insights from executives in health systems, and was focused on IT. So if you are in IT and you're concerned about cybersecurity, telehealth, or interoperability, and these are things that you're looking for, this might be a good paper to read. It's not too lengthy. It's about 30 pages. And it has some pretty good insights, I think, in some key areas, so feel free to give that a read. Next 2 that I really actually liked, I've read through these fully a few times just because they were really captivating, is one is a digital health implementation playbook, and this is from the American Medical Association. And this is a pretty big deal because the AMA is really going full-bore digital health. And what they did was they put together this document. This thing's huge. I'm talking about over 60 pages almost. And it's a guidebook for providers looking to implement digital health. It is actually, in terms of the quantity information, is actually really lean. It's really more descriptive and image heavy, but take it for what you want. And what the guidebook actually focused was a case example using remote patient monitoring in this instance. And they give you a walkthrough how you would implement this. There's some helpful guides and such. And I think if you were really getting into the digital health space and you want to use this, let's say in your own clinic and such, this might be really worthwhile to look into, just because it kind of gives you a rundown. How would you talk about reimbursement? How would you talk about workflow? How would you implement it? How can you check for the quality of your care that you're going to go with it? And I think it's going to be a good way for those that have never been involved with this to kind of look at it and say, hey, this might be something you want to implement, and these are good resources to use. So definitely I would keep an eye on this. Next one is from the Digital Therapeutics Alliance. And this was basically a white paper that was defining digital therapeutics. So if you're relatively new to the digital therapeutics area, I would really give this a read, because you're one of the few people out there who have actually gone through and tried to define this topic. And if you look in the literature, there's not that much out there just saying this is digital therapeutics. It is a wild, wild west we're facing right now, just like mobile medical apps has been. But in this case, when we start talking about companies that are getting into digital therapeutics and actually having evidence showing impact on patient care, I think we need to start taking it seriously. So DTX or DTA it basically has put this together. It's about 20 some pages, more or less just giving a lot of the leg room and saying this is what we're dealing with. So that's it, guys. Thank you for listening. If you have any comments on any of these articles, feel free to comment on them below. And take care, and we'll be resuming back in December. Happy holidays.